गया, धूप लग गया. And what actually happens to these things is that the hemodynamic mechanism or thermodynamic mechanism that our body has, that is not able to keep our body at the normal temperature where it should be. So today, first of all, I would be talking a little bit about how our body tries to keep our temperature to the normal range, what happens wrong during summer, what is heat cramp, I mean disease associated with these diseases. So the first of all, I will be talking about thermoregulation. Human body maintains a steady temperature through the balance of internal heat production and environmental heat loss. So heat exchange between the body and environment occurs through radiation, evaporation, conduction and convection. However, in extremes of temperature, this mechanism gets decompensated, and during summer we may have too much of body heated on, and if this thermoregulation is not working adequately in winter, we may have very cold body. What happens in warm climate? See, to keep our body at a normal temperature, our body keeps losing heat. Body produces heat inside the body because of the metabolic reactions that occur to keep us alive. And then our body loses heat mainly by conduction, convection, and radiation or evaporation. So when temperature or ambient temperature is less than 32.7 degree, our body is in contact with air which is cooler than our body, then our body keeps losing heat. However, if the ambient temperature becomes more than 37.2, then environmental heat would start coming inside our body. Now at lower temperature, evaporation constitutes only 20%. पसीना उतना ही कम आता है low temperature पे, तो evaporation से जो weight heat loss हो रहा है, that is less. However, as the temperature rises, loss from evaporation becomes much more. And at higher temperature, that's why we tend to sweat a lot, so that when water evaporates from the body surface, the heat used for evaporation comes out from the body, and thus body loses heat. This is what it happens. Now when the weather becomes humid, there is a lot of moisture in the environment, this evaporation mechanism also gets decompensated, and then effective cooling does not occur. Now let us talk about hyperthermia. Hyperthermia means increase in core body temperature. So our core body temperature is usually 37.2 degrees C, that is maintained. Now when body is unable to maintain this normal internal temperature through heat loss, then we develop hyperthermia, that is increase in the body temperature. Now this increase in body temperature may occur because of two factors. Either my body is not able to lose adequate amount of heat, or there is excessive production of heat inside my body. So excessive production of heat may occur because of increased metabolic rate, it may occur because of seizures, it may occur because of fever or some drugs. But there are heat stress which is usually caused when there is combination of environmental factor and metabolic heat. These climatic changes may significantly contribute to the risk of heat related conditions. So what are the risk factors? Who are the people who will develop heat related illness, or what are the conditions in which heat related illness may occur? So if a person is working in a hot environment for longer duration without adequate hydration, without adequate acclimatization, so if acclimatization has not been done, then there are chances that body may get heated. Skin disorders or other medical conditions that inhibit sweat production. Sweat production is there, then evaporation occurs and it cools our body. So if there is ineffective evaporation, ineffective sweat production because of some medical condition, obese people, prolonged seizures, hypotension, reduced cutaneous blood flow, or reduced cardiac output, these are the conditions in which body may get abnormally heated. See, the body loses heat, internal heat, by increasing blood flow in the skin, so that whatever heat is inside the body comes on the surface, and from surface it is lost either by conduction or evaporation. But if there is decreased blood flow in the skin because of any reason, the heat loss mechanism will get compromised. Certainly there are certain drugs which increases internal metabolism or muscle activity, which leads to increased heat production. There are certain illicit drugs. Apart from that, extremes of age, like I mean a newborn child or a very old child or chronic debility, so debilitation, it means a person is not able to adapt to environment. In them also there is increased risk of heat related illness. Then let us move to the first disease that we are going to talk about, is heat cramp. This is very common nowadays. We are having cricket match, IPL going on, and we might have seen that during exercise at times cramps occur in muscles of the player. So when there is exercise associated painful involuntary muscle contraction during or immediately after exercise, that is called heat cramp. Now why this heat cramp occurs? This heat cramp occurs because of inadequate electrolyte supplement. I mean, a person is exercising, sweating too much, and he is taking plain water. So if he is taking only water, electrolyte replacement is not being done adequately. Person may develop hyponatremia, that is decrease in sodium level in the body, and because of that person may develop heat cramp. What are the findings that we see? This is usually, it can be recognized clinically. Muscle is usually painful, it is lumpy, hard. However, body temperature is usually normal or slightly increased, because we know sweat mechanism is already there. So skin is moist, skin would be cool, and vitals will be stable. The only problem that you will see, that muscle is tender, hard, and there is twitching in the muscle. How to treat it? The first and foremost thing that we would suggest is that person should stop all activity which is causing heat cramp. So playing, exercising, or working, that should be stopped. Person should be moved into a shaded or cool environment, and then oral isotonic or hypotonic rehydration should be done. Oral salts are not to be given. And for muscle cramps and spasm, we need to simply give massage and gently stretch the muscle so that the spasm or the cramps get relaxed. The most important thing that I wanted to say, that whatever be the cause of muscle cramp, we have to advise rest for at least 2 days with continued dietary supplementation before returning to strenuous exercise, because whatever electrolyte imbalance has occurred, it will take its own time to recover. Now moving to the next problem associated with heat, it is heat exhaustion. Heat exhaustion is what, you get completely exhausted in the heat. So there is a lot of dehydration, there is sodium depletion, isotonic fluid is lost. So there would be accompanying cardiovascular changes, blood pressure will fall down, pulse rate would increase. You will, the person will feel that if he or she doesn't have any energy, difficult to even stand. So that is called heat exhaustion. It results from prolonged strenuous activity in hot environment without adequate salt and water intake. Now heat exhaustion is basically diagnosed clinically. Core temperature are slightly elevated, but usually less than 40 degrees C. Person will have tachycardia, that is increase in heart rate with decrease in blood pressure. However, sweat mechanism is intact, so skin will be moist. There could be additional symptoms like nausea, vomiting, malaise, myalgia, hyperventilation, thirst, and weakness. Sometimes there are CNS symptoms which include headache, dizziness, fatigue, profound weakness. And when heat exhaustion progresses, it may get converted to heat stroke. Now, what is heat stroke? When sweat mechanism ceases, so sweating ceases, the skin become dry, hot, red, and then there is accompanying decline in the mental status. That is what heat stroke happens. How to administered intravenously, because at times a person with a heat exhaustion may be having nausea and vomiting. They are not able to tolerate oral administration of fluid, and in those cases physiological saline or isotonic glucose solution has to be given. Here also, a rest of at least 48 hours and adequate rehydration is recommended before starting normal physical activity. Moving to the third heat related illness, that is heat syncope. Syncope is basically transient loss of consciousness with a spontaneous return to normal mentation. What happens? There is volume depletion that leads to decrease in systemic blood pressure, that leads to decrease in blood flow to the brain, and once blood flow to the brain is decreased, a person becomes unconscious. He falls down, blood flow to the brain regains, and consciousness is achieved. So this exercise associated postural hypotension is usually the cause of heat syncope and may occur during or immediately during exercise. Excuse me. Heat syncope occurs in the setting of prolonged vigorous exercise, actively prolonged standing in hot and humid climate. And what do we see? Since sweat mechanism intact, so skin will be cool and moist. Since blood pressure is low, so low systolic blood pressure with weak pulses would be seen. What are the treatment for heat syncope? It is basically similar as heat exhaustion. You need to give adequate fluid. Of course, person should be removed from hot place. He should be brought in shaded and cool place. Fluid and electrolyte replacement by mouth or intravenous should be done. Now let us move to the most serious complication of heat related illness, and that is heat stroke. So heat stroke is a severe form of heat related illness resulting in cerebral dysfunction. Cerebral dysfunction means mental status is degraded. Person will lose his consciousness. So resulting in cerebral dysfunction with core temperature going above 40 degrees C. So what we were seeing in all other condition, core temperature is less than 40. So if a person exposed to heat comes to you with temperature more than 40 degrees C, skin is dry, hot, it is heat stroke. Now heat stroke can be of two types, classical or exertional. What we are going to talk today is exertional heat stroke, which occurs in healthy person who undergoes strenuous exertion in hot or humid climate. Classical or non-exertional heat stroke occurs in patients with impaired thermoregulatory mechanism or in extreme environmental conditions. Let us understand how this heat exhaustion gets converted to heat stroke, or what is the differences. In heat exhaustion, blood pressure is low, pulse is low, but sweat mechanism is there. So skin would be pale, cool, moist. Person may have muscle cramps, but pulse will be weak and rapid. There would be excessive sweating. Now if sweating stops, then internal core temperature starts increasing. That is how it gets converted to heat stroke. So there would be throbbing headache, no sweating, there will be rapid and strong pulse. Person may have nausea, vomiting. Person's skin would be red, hot and dry, and person may lose consciousness. So how does heat stroke presents? The presenting symptoms include all findings seen in heat exhaustion with additional neurological symptoms like dizziness, weakness, emotional lability, confusion, delirium, blurred vision, convulsion, collapse, and unconsciousness. Physical examination finding may be variable, therefore unreliable. So you not be by physical finding you may not be sure. So you have to see that patient has come from heat, body temperature is high, and there is unconsciousness. Exertional heat stroke may present with sudden collapse with loss of consciousness followed by irrational behavior. Sweating is usually not present. There are certain other important things that we should consider when we are dealing with a person with heat stroke. It's a life-threatening emergency, and we have to monitor certain body organs because there is tendency for its damage, which include kidney injury, liver injury, metabolic derangements, respiratory compromise, coagulopathy, ischemia. However, initial laboratory findings may be non-specific or normal. There are certain complications which may occur with heat stroke, and because of these complications only, if heat stroke is not treated appropriate and early, mortality may be as high as 25 to 30%. So in heat stroke, person may develop hypovolemia with cardiogenic shock. Heart may stop pumping. Metabolic abnormalities like electrolyte imbalance, cardiac arrhythmias. Heart rate may get decompensated, heart rate may get deranged, and there may be cardiac arrest. Coagulopathy, adult acute respiratory distress syndrome is also common. Because of heat, the lung parenchyma may get damaged, swell, and breathing problem may start. Hypoglycemia, rhabdomyolysis, that is loss of muscle, seizure, organ dysfunction, and infection may occur. At times, because of muscle necrosis, severe edema may occur in limbs that may lead to compartment syndrome. How to manage heat stroke? We all know that person is having improper mentation or mental condition is not adequate. So the first thing that we need to take care is ABC, which include airway, breathing, and circulation. Treatment is aimed at rapidly reducing the core body temperature within 1 hour while supporting circulation and perfusion. So you have to support circulation, perfusion. You measure heart rate, so cardiac monitoring, pulse oximetry has to be done, along with fluid intake and output charting has to be done so that circulation is adequately maintained. Circulatory failure mostly due to shock are from relative or absolute hypovolemia. So oral, when a person is conscious, oral rehydration has to be done, or intravenous fluid administration must be provided so that adequate urine output occurs. So urine output is just important parameter which tells us that if adequate water supplementation or fluid supplementation is being done or not. Now moving to cooling, choice of cooling. As I said, that attempts should be made to bring the body temperature to the normal or below 39 degree within 1 hour. So what are the options? Remove all clothes or keep minimum clothes. Excessive clothes should be removed. We can sprinkle water on that. After sprinkling water, we may use fan or air conditioning so that body gets cool. We may put ice packs, cold towel, or these are the things which has to be done. So what is the choice of cooling? The choice of cooling is that cooling which can be instituted fastest, because the importance is temperature has to be brought down within 1 hour. So choice of cooling depends on which can be instituted the fastest with least compromise to overall care of the patient. There are basically two methods: evaporative cooling and conductive based cooling method. Evaporating cooling method is preferred in non-exertional heat stroke. Conducting based cooling is preferred in exertional heat stroke. What is this evaporative cooling? Evaporative cooling, water has to evaporate from the body surface. So care has to be taken that maximum amount of body surface is exposed to environment. Then you put water on that and you play fan. So wind from fan comes or air conditioner comes and water evaporates. That is how evaporative cooling occurs. So we have to place undressed patient in lateral recumbent position or supported on hand and knee, because if you put on hand and knee, then maximum amount of body is exposed to environment. So while the entire undressed body is sprayed with lukewarm water like 20 degrees C and cooled by large fans circulating in the room. Addition of inhaled cold air may also be helpful. Now conductive based cooling, what is this? Conduction means a person may be immersed in cold water or ice water. However, certain efforts has to be taken that cramps do not or shivering do not occur. So cold infusion, gastric or bladder lavage, ice water or cold water immersion. Ice packs are most effective when covering the whole body. So just putting in, just putting ice packs in axilla and groin is not going to work. Ice packs have to be put throughout the body. Intravascular heat exchange catheters can also be used. Now there are certain precautions when we give cooling therapy to persons. We all know when we are exposed to cold, shivering occurs. So shivering should be avoided because it inhibits effective cooling by increasing internal heat production. So muscle contraction will occur and internal heat production would occur. So shivering should be stopped. So what can we do for shivering? Medication can be used to suppress shivering, including magnesium, quick acting opioid analgesic, benzodiazepines, and quick acting anesthetic method. A skin massage is usually recommended because when there is cold cutaneous blood flow to the skin. Cutaneous vasoconstriction may occur, decreasing the blood flow to the skin, so skin massage is recommended. Now let me tell you, there is absolutely no role of paracetamol, aspirin, NSAID in management of heat stroke. We all know that these drugs work through the thermoregulatory mechanism, and since thermoregulatory mechanism is compromised, so hyperthermia is occur. So giving antipyretic medication has got no effect on environmentally induced hyperthermia, and it is contraindicated. It is contraindicated because there is no benefit out of it, and the person is at risk of developing liver injury, kidney injury, and if you give these drugs, chances of injury may increase. Treatment must be continued until core temperature drops to below 39 degrees C. Now at the end, I would like to move how to prevent heat related illness. The first and most important thing is education. Education is necessary to improve prevention and early recognition of heat related disorder. So individual may take steps to reduce personal risk factors. So if you are educated, you are going to take precautions so that you are not exposed to hot environment, or you get acclimatized to hot environment before exposure. For prevention of occupational heat related illness, a comprehensive preventive program should assess personal risk factor, estimated wet bulb globe temperature, workload acclimatization, and early recognition of the symptom. Let me tell you, early recognition of the symptom is one of the most important aspects, because if you recognize early, you will stop it from progressing and you will treat early so that person does not develop complication. So early recognition of the symptom is really very, very important. Coaches, athletic trainer, athlete, and parents of young athlete must be educated about heat related illness, specifically about prevention, how to prevent it, what are the risks, what are the sign symptoms, so that they can recognize it early and they can institute treatment early possible. Medical evaluation and monitoring should be used to identify at risk individual and weather conditions that increase the risk of heat related illnesses. Now, those who are physically active in hot environment must increase fluid consumption during and after physical activity. Fluid consumption should not be limited to water only, but it should include balanced electrolytes also. Close monitoring of fluid and electrolyte intake and early intervention are recommended in situations necessitating exertion or activity in hot environment. And the best way for monitoring fluid is that regular urination. If a person is having adequate urine output, this suggests that there is adequate fluid in the body. At the end, I would like to summarize all the illnesses related to heat. There are a spectrum of preventable heat related illness. See the importance, they can be prevented. These include heat cramps, heat exhaustion, heat syncope, and heat stroke. Heat stroke is the most serious form of hyperthermia in which cerebral dysfunction occurs because of heat exposure. Now, best outcome comes when there is early recognition. You are able to recognize it early. You have to remove the person from the hot environment. You have to initiate rapid cooling, because delay in cooling results in higher morbidity and mortality in people having heat stroke. And once again, what is the best cooling method? Whichever method which can be instituted the fastest with least compromise to the patient. So best cooling method is which can be started earliest possible. So this is how we can prevent heat related illness, treat heat related illness, and the most important is awareness about this heat related illness. That is what it is most important. Thank you very much for your patient hearing. This is the hospital Health City Vistar at Gomti Nagar Extension, Lucknow, where we work and we try to give world-class health-related facilities in Lucknow. Thank you very much. Bye-bye.
Thank you so much, sir.